Good morning, everyone. It's really nice to finally meet you after a long period of absence. Today's topic is on harassment at workplace. It's a bit of a different topic than the ones we usually discuss at our academic cover. But let me tell you why we selected this topic. As you all remember, the disheartening incident that took place a few months back. Yes, that incident that shook us all to the core. Even though the media and social media hype on the subject is long gone, GMOA is working tirelessly to address the issues in a much wider arena. In par with that, we've created an auxiliary committee to address the safety issues of doctors. And as a part of the action plan, they have requested the academic subcommittee to conduct a lecture for our members, and hence today's lecture, Harassment at Workplace. Zero tolerance is the only way forward. And to conduct this lecture, we are having the honor of introducing our guest speaker, Dr. Vindya Wijayabandara, Consultant Psychiatrist, National Institute of Mental Health. Dr. Vindya obtained her MBBS from University of Colombo in 2006 and completed her MD Psychiatry in 2016 from the Postgraduate Institute of Colombo. She had her training in psychiatry at the psychiatry unit in Cardiff, United Kingdom, with a special training on managing addiction and gender-based violence. So with a great resume, we are thrilled to have you on board with us, madam, to present this lecture. So I kindly invite you to commence the lecture.
Hello, everyone. Good to have you all. So my topic for today is harassment in the workplace. Zero tolerance is the only way forward. Let me briefly outline the layout of my lecture. So I'll be briefly discussing about what is harassment, why should we be aware, and maybe you are a victim, or knowingly or unknowingly you might be a perpetrator as well. And the last and the most important thing is what can we do? So what is harassment? So harassment is defined as it includes unwanted behavior designed to annoy, threaten, intimidate, or demean. So I don't think any word in this definition would make us interested in undergoing through. So harassment definitely involves unhappy encounters. Mostly it's unwelcome and unwanted. So what do you think the victim would agree or disagree? Sometimes we see post-event sequelae, people comment, he was okay with it, didn't refuse. But let me redefine, harassment is unwanted. So whether willingly or unwillingly, the victim will never say yes. So it definitely involves threatening, intimidating, demeaning behavior that is quite unpleasant. There are many forms, to be frankly, with people say, I have been threatened. It could be a verbal, it could be a written kind of thing, or it could be through actions. Sometimes we use photographs, pictures, sometimes derogatory comments. Let me a little bit elaborate on comments. Sometimes the comment may not necessarily be derogatory. It could be neutral, but mimicking quite negative. For example, එයාගේ හැටි අපි දන්නේ නැද්ද? So, it need positive or negative, clearly. But the underlying true meaning is necessarily negative. So, sometimes the comments definitely may not be negative in plainly, but definitely sounds quite negative. It could be insults or taunts. So taunts. Insult, we would really clearly see, ඔන්න මට කිව්වේ negative remark එකක්, මට threat එකක් දුන්නා. But taunting හරියට විහිළුවක් වගේ. So the intention the perpetrator may use is humor මම පොඩි විහිළුවක් කරේ මෙයා වැරදියට ගත්තේ. So fault is blamed upon the victim, the receiver. So remember, taunts is a very common form of harassment that is quietly ignored by many of us. What do you think about offensive physical touching? We would be annoyed with shouting, which is heard by everybody, but remember, touching could be very not seen. It should be done in hidden. The touching, if I would say, even if it's obvious or very not obvious, it could be quite offensive and quite traumatic for the receiver. Physical interference. So, people may say, I was not given opportunity to work as usual, or I was stopped or interfered. Remember, these interferences could be done by a colleague, a patient, a bystander, or anybody in our workplace. But if it interferes our duty, or if there is an obstruction to our work, which really upsets you, again, that falls under harassment in the workplace. What do you think about the phone calls? People will say, I tried to reach you 100 times, but you're not answering. Learn today, even repeated phone calls or other means of trying to reach, again, could fall under harassment if it really distresses the receiver. So, interestingly, these are several forms which I'm quite sure some of y'all are first time hearing through my lecture. The forms and damages could be again classified into several ways. As I said earlier, physical, a touch, assaulting or punishing, then verbal so that everybody could hear. Remember, under verbal there could be non-verbal gestures as well. Emotional harassment, yes, with comments, gestures, that could be emotional harassment. The psychological, unfortunately, people see the physical, people hear the verbal, but the psychological harassments, which are very hidden, but yet very distressing. Last but not least, the sexual harassment. Remember, again, sexual harassment could be physical forms, verbal forms, emotional forms, or psychological forms. The sexual forms, it could be through a lecture where the certain photographs would be very distressing to the viewers, or it could be comments that is made in public, which will be distressing to some, but not so distressing to some. So, sexual harassment, again, harassment as a whole, the individual experiences may differ. Right. So, why do you think different? Some may get harassed or really annoyed at first instance, but not everybody. So, there are certain risk factors where we elaborate along with harassment why everybody is not affected equally. So, let me begin with power or authority. So, if somebody asks who is more harassed, people with more power or less power? Exactly. So, the least power will be harassed to the more power, people who are holding more power. So, usually, it's an authority figure who will be diverging harassment to the least powerful. And methane, interesting fact. So, including myself or even the viewers, listeners, you all would have been a junior doctor, junior colleague sometime back. Remember, the junior colleagues are the most vulnerable. So, look into your team. In your team, there will be junior, senior, equal. Remember, it's usually senior versus junior. So, the juniors are the most vulnerable, but that not necessarily mean the senior colleagues are immune. So, remember, the vulnerability is kind of a probability we are talking. So, the junior colleagues are more at risk. I have listed gender, interestingly, as the second factor. You think more females are vulnerable or males? Exactly. So the risks are there for both genders, but statistically, females are more vulnerable. So if we compare male versus female, they said 2 to 1 more females. At workplace, statistically, they have shown 1 in 3 female will be harassed once in their lifetime at work. For males, it's 1 in 5. Interestingly, yes. So that includes almost all of us. What do you think about the social support? So if you have more support or least support?
The least support.
Exactly. The least support, remember, some people are least connected. Some people are connected. They are easily making friends. They have so many people to support you. So usually the least connected or people who are more or less isolated are more vulnerable. Adaptive skills and resilience. These are kind of our survival skills. What does adaptive skills means? You can be anywhere. You can add on skills, give away skills. Resilience is kind of a power that you can bear up at least a reasonable level of tolerance. And මෙතන තමයි වැඩේ. So the resilience or කොච්චර අපිට දරා ගන්න පුළුවන්ද? So as a culture or as a nation, සමහර විට කියනවා දරා ගන්න. So what is දරා ගන්න to? Is it to bear up anything? නොතන තමයි ප්‍රශ්නේ තියෙන්නේ. So our attitudes does not bearing up everything and anything. So resilience is all about adapting to a new situations and can divulge your duties without interference. අපි රස්ස අලුත් තැනකට ගිහිල්ලා එතන ටීම් එකට පිටින් වෙලා වැඩ කරගෙන යන්න පුළුවන් ස්කිල් එක තමයි resilience කියන්නේ. එහෙම නැතුව බනින ඔක්කොම අහන් ඉන්න කියන කුණු කතන්දර ඔක්කොම අහන් ඉන්න එක නෙමෙයි. එහෙම නැත්නම් ටීම් එකේ වැඩියෙන්ම වැඩ කරන එකක් නෙමෙයි. So what about mental health and physical health? As you all know, body mind goes in balance. So for us to work as a professional, our body and mind has to be in balance and we call it well-being. හොඳට තියෙන්න ඕන. යහපැවැත්මෙන් තියෙන්න. So if you are already having mental health issues or chronic physical health issues, again, you are at risk. Where mental health issues or physical තියෙනකොට we can't adapt very well. Okay, the skills and your health are interconnected. And the last I have list general attitude of the on harassment of the culture or the community. කියන්නේ දැන් අපි පොදුවේ අපි කට්ටියක් විදිහට ගත්තහම as a community, do we condone or do we condemn? කමක් නෑ. නෑ කීයටවත් මේක වෙන්න දෙන්න බෑ. The general attitude එක හරි වටිනවා. Why? Depending on the general attitude එක, either we accept or refuse. Harassment to any degree should be condemned and not welcome. Harassment has so many effects. To begin with, stress, work-related stress. Then අපේ රස්සාවේ stress නෑ කියනවා නම් I don't think anyone of those people are working. So anxiety, we will live to death. And on top of the general anxiety, we are overloaded with work-related stresses. The stress at work will make you take days off 1 in 5. මේක ලොකු ප්‍රශ්නයක්. අපස්සනෙන් ගත්තොත් එක්කෙනෙක් වැඩට එන්නේ නෑ. Stress එක දරා ගන්න බැරුව. Stress is a very huge thing. Yet පේන්නේ නෑ, දන්නේ නෑ, අහන්නේ නෑ, අපි හිතන්නේ. Why should we be aware? Because it could be anyone, including me. Even I could be a victim, or as I said before, I could be a perpetrator. I'll tell you in few slides why me, I can be a perpetrator. Lifetime risk, I said 1 in 3. So females, girls, you are at risk. You need to look after yourselves. And overall healthcare workers, the WHO data says 62%, that's 2/3 of our health workers, we have encountered harassment during work at work, divulging our duties. මේක තුනෙන් දෙකක් කියන්නේ. It's a huge number. The most common form is verbal abuse. I will say 100% you will agree with me. දැන් මෙතන ඉන්නවා නම් අහගෙන verbal abuse නිවිච්ච කෙනෙක් අපිට අර අබ හොයාගත්තා වගේ කතන්දරයක් වෙයි. So verbal abuse is very common, including me, up to date, even now, even yesterday I was verbally abused. So it's almost like a day-to-day encounter. Followed by threats, 1/3 threats, and sexual harassment, 12%. 12% is also very high. See, 1 in 10. 1 in 10 healthcare workers have encountered sexual harassment at work. This is taken out of a systematic review. Then systematic review, it's a pool of so many researchers. So WHO has published, and this was a need to intervene, reason to intervene for them. From 2023 onwards, of a mental health days, we are celebrating with the theme of mental health at workplace. So, අපි මේ 25 වෙනකම් 3-year celebration එකක් යන්නේ of everything, and all, I mean we do work a lot on improving mental health at workplace by because of these data. Again, I'm putting on a slide so that you will be convinced. 1 in 3 women, 1 in 5 men. This is Australian data, and 37% of workers report being sworn or yelled at. 37%, even in Australian setting. 11% of workers, 1 in 10, unfair treatment due to gender. So they have they have diverged gender-related issues. So it has so many statistical significant impact. The impact on victims, I have specially listed the mental health impact. Why? It results chronic suffering and poor quality of life. We all work, we earn at the end of the day. Why? Because we love this job. But if we are to encounter harassment, definitely our quality of life, long run, definitely gonna go down. And it definitely has a high risk of mental illness, up to 2/3. As a risk of axis 1 mental illness, mood disorder, and anxiety disorders are most common. And take the data very importantly. Why? Even up to quarter, 1 in 4 will have major severe depressive episode. What do you think about a lifetime risk? We always talk about risk of cardiac encounters, risk of stroke with stress. Lifetime risk of mental health issues, especially depression and late-stage dementia, increases with harassment at the workplace. And if you are to encounter harassment, and if there's mental health sequelae afterwards, the symptomatology or the severity tend to be more severe. ඒ කියන්නේ harass වෙලා victim වෙලා දැනුත් වැඩිපුර ලෙඩ වෙනවා ජීවිත කාලෙවත් දුකින් එනවා. So obviously why I am repeatedly stressing this is harassment has no benefit at all on anybody. I have listed PTSD and post-traumatic stress disorder. Obviously it's not right now, much later. You were blamed for a very small thing. Let's say the senior colleague blames or pulls you up for a little thing. Punchi dekata kෑ ගැහුවේ. But we don't know the impact on the receiver. Victim ගේ impact එක දන්නේ නැහැ. She would have kept it hidden. Doctor stress reaction එකේ මුලින්ම ඉන්නේ denial. මම එහෙම කළාද නැද්ද? Disbelief. ඊපස්සේ මං එච්චර දෙයක් කරාද බැනුම් අහන්න. Then guilt. මං ලොකු වැරද්දක් කරන්නේ නැති. මම වැඩක් නැති කෙනෙක්. Helpless, hopeless. Then the sequelae comes. After many more months, you might feel like reliving the experience. ආයි බැනුම් අහනවා වගේ. ඒ තැනට ගියාම එයාව දැක්කම ආයි බැනුම් අහනවා වගේ. Then you feel like avoiding. සමහර අය වැඩට එන්නේ නැහැ. Temporary attachment හදාගන්න යනවා. ප්‍රශ්නේ මගහරින්න. The real problem is after even many more months you are suffering the first encounter or the vetch incident එක I repeatedly experiencing. So people with PTSD will definitely have a much later years of suffering. The PTSD, the avoidance කියන එක දැන් ඒක part එකක් නේ. In PTSD, when we relive the experience, we try to avoid. එතනට යන්නේ මුණ ගැහෙන්නේ temporary attachment එකක් හදාගෙන වෙන තැනකට යනවා. But take my word, unless a proper professional help is taken, you will have same experience even in the different setting. Avoidance or temporary change of the workplace is not the solution. Temporary attachment එක හදාගත්තට කමන්නේ. If you having features of PTSD, you need professional help. මොනවාද අපිට දෙන්න පුළුවන්? To begin with, psychological support. Then, as soon as something happens, you are very upset. Sometimes you do want to talk about, sometimes you don't want to talk. So you have to respect both ways. That's up to certain extent, we let them open up, ventilate, but after a certain thing, do not pressurize the victim to කියන්න මොකද උනේ. So psychological support should be given with due respect to the victim's interests, beliefs, and if she doesn't want to dialogue, let her calm down and then let her open up. Empowerment and safety. That's where we all come in hand. Empowerment for what? To open up. So why people don't open up is because they don't believe that others can help. So we need to get together, why? To show the victim that we are there for her and she can open up, reach and ask for help. The safety, very important. Whose safety? It's not your safety only, it's about my safety, our all safety. So ensuring safety of mine is equal to ensuring safety of all of us. So unless you ensure safety and let them open up, definitely, as I said, people will never open up, keep silent. The social support, sometimes there will be change, we need to change the place, change the unit, change the shifts, right? So depending on the situation, do not generalize always. So depending on the situation encounter, there will be social support needed. So that's where the local community, local team comes in handy. For example, if a doctor is affected, all doctors get together. Why? That is where the social support comes. Last not by least, legal support. Why? Ensuring the safety or the space and environment to conduct their duty as an officer, I would say, a professional, is one of the basic needs and necessities of our job. So if we are given a job and if the job roles ask us to do things, the administration or the government is definitely held responsible for ensuring our safety and so that we could conduct our job role. So as a community, or what we can do is get together and strengthen ourselves, get ourselves empowered, collectively take measures so that the administrators, governments are convinced enough to provide safety and security more and more. At the same time, there are certain legally supported encounters where harassment can be punished, which I will tell a little later. So, is it only victims, those who need help?
No, sometimes.
As a mental health professional, I would say even the perpetrators do need help. Why people harass others? It could be they are already having mental health issues, not necessarily illness, but issues. So, the perpetrators, so-called alleged people, alleged bad ගහන එක්කෙනාට උදව් ඕනේ. They might be having poor impulse control, or they have personality issues, or take my word, they must be having substance use disorders. All these three go hand in hand. So these three, definitely people will benefit from counseling, sometimes treatment, but definitely at least helping the perpetrators to open up. Seek, reach for help. Now comes the dilemma. What if the perpetrator among us? So I began my presentation saying we could be victims, we could be perpetrators, willingly or unwillingly. Unfortunately, we are bystanders of harassment in certain settings. ඒ කියන්නේ සමහරකට දන්නේ එච්චර හිතන්නේ ඊක හැරස්මන්ට් එන්නේ කොහොමද? උන් තමයි හදලා ගන්නෙ. ජීවනයේ කෙනෙක් ආවහම හදලා ගන්නවා. So we are not racing ළමයි හදනවා නෙමෙයි. So we are sometimes we see but don't see, we hear but don't hear. We take things for granted. We are bystanders and silent perpetrators. Remember, silent perpetrators. So this is a very important thing which we need to individually be sensitized. අපි මේකට සංවේදී වෙන්න. ඒ කියන්නේ දැන් මම අර කියපු එක ෆෝම් එකක් හරි කොහෙදී හරි කොතනදී හරි වෙනව නම් first thing is අඳුන ගන්න එක, identify. Then මේකට මම මොකද කරන්නේ? මම කියපු data වල හැටියට even I could be he or she. දැන් මෙතන victim ගේ role එකේ මම වුණා නම් මම මොකද කරන්නේ? මම දැන් බලලා silent win එකෙන් මම මොකද කරන්නේ? මම perpetrator උදව් කරනවා. So this is a very highly sensitive සමහර වෙලාවට අපිට ethics හැටියට අපේ duty එක හැටියට සමහර වෙලාවට we also having mixed ideas whether to act or not act. The gold standard would be not tolerating any amount of harassment because other air hit mama. So I'm next in line. You have to think like that. Then only we can stop for harassment. Plus, why we are doing this all because of myths and stigma. I'll stick with stigma. Then harass even the victim don't feel like telling, opening up. Then mang make a boss tequila, boss mono, I tied the mangan. Him and a time, mang anically tequila, ya mangan. The victim is usually helpless. You think anybody wants to accept the fact that we are weak and we are like vulnerable? No. එක ඔය victims ලා ගෙවෙන එක දෙයක් තමයි vicious cycle of re-victimizing. දැන් මම ගිහිල්ලා කියනවා අනේ මට මෙහෙම එකක් වුණා කියලා the second person who listens may be the perpetrator next. So there is a re-victimizing trend as well as labeling the victim as very weak. යාට කිසිම support එකක් නැහැ. යාට කිසි දෙයක් කරගන්න බෑ. මේකින්ද definitely these two has to be removed and erased. It's not because you are weak that the setting or the encounter has made you weak. That's why you were victimized. අනිත් එක තමයි victim ගේ වරදින් වුණා කියන එක. You blame the victim. මෙයා ඉල්ලගෙන කාලා තියෙන, ඉල්ලගෙන harass වෙලා තියෙන. Nobody asked for harassment. Take my word. So all my experiences in handling all these harassment cases. So I have been working as a consultant for the past 8 years. So every station I worked, I had been handling directly all these cases, harassment in the workplace. So right now, my workstation, I'm directly involving. So all the cases, I didn't find anybody asking for being harassed. කවුරුත් ඉල්ලගෙන harass වෙන්නේ නැහැ. ඒ හින්දා මෙයාගේ මේ victim ගේ වරදින් වුණා කියන එක it's a myth. And we should definitely refuse it. ඊළඟට stigma කියන එක තමයි අර දැන් මේව කතා කරන්න ගිහලා අමාරු වෙටෙන එකත් එක්කම nobody people hates whistleblowers. Yes. System එක කඩාගෙන යන්නේ මෙයා තමයි මේ ප්‍රශ්න ඇති කරන්නේ. අපි හොඳට ගියා ටීම් එක කවුරුත් කතා කරේ නැහැ. People hate whistleblowers. මෙන්න මේවා තියෙන තාක්කල් people open up වෙන්නේ. They will see this is how it is. දැන් සමහර ඒවා තියෙනවනේ culture එකේ දැන් harass කරන්න කෙනා කියන්නේ මෙහෙම අපි මෙහෙම තමයි මේක තමයි normal ක්‍රමය. ඔයා මේ අලුතෙන් ඇවිල්ලා දන්නේ නැහැ. So there is no single culture which will condone harassment. Normal කියලා harassment එක කිසිම culture එක නැහැ, කිසිම team එකක නැහැ. So that they have put into their arbitrary setting. හරිද? එතකොට මෙන්න මේ හැරස් කරන කෙනාගේ දාගත්ත කතන්දරේ තමයි කල්චර් එකේ දාගත්ත එක තමයි normal නම් ඔයා හැරස් වෙන්න ඕන. You have to say nothing about it. You should undergo. The same goes for ragging, I would say. Rag කරන කියන්නේ මේම normal නම් මේක ඔයා normal නම් ඔයා rag එක කාලා එන්න ඕනේ. rag වෙලා එන්න ඕනේ. ඔයා abnormal හින්දා මේ rag එකවත් දරා ගන්න බැරි නම. Harassment at workplace, it's not normal, highly abnormal. So, nothing to do with the victim blaming, re-victimizing them. When we are empowering people and as a community, we are get together and fighting against. Right? Remember, any educational level, any social class, any one of us can be a victim. දෙවගානිත් පැත්ත අපි මේවත් silently දැකත් ඉන්න ඇති. එහෙනම් what can we do? So before we go for what can we do, I'll take out few sections out of the penal code. That legal system මේවට නීති නැහැ කියනවනේ, නීති තියෙනවා. Section 342 about assault. කෙනෙක්ට පහර දීමේ චෝදනාව. පහර දීමේ චෝදනාවේ they have in detail elaborated any gesture, any preparation. දැන් ඉංගියනොත් assault කරන්න පුළුවන්. ලෑස්ති වෙලත් assault කරන්න පුළුවන්. මම ගහනවා කියලා පොල්ල ගත්තාම නෑ ගහන්න නෙමෙයි ආදරේ කරන්න කියලා බෑ. Section 342 යටතේ you are found guilty. 344 criminal force to deter a public officer from discharge of duty. Bystanders or patient lapita ගානකොට threat කරනකොට it comes under section 344. ළමයි ඔයගොල්ලෝ මේක දැනගන්න ඕනේ. මොකද මේව දන්නේ නැති තාක්කල් මිනිස්සු හිතනවා ඒගොල්ලන්ට ඕන දෙයක් කියලා යන්න පුළුවන්, කරලා යන්න පුළුවන් කියලා බෑ. මේකේ තියනවා prevent or deterring. ඔයා කරන වැඩේ පරක්කු කළත් if they are delaying your duty, that is also comes under section 344. 345, it's sexual harassment. ඒකෙත් sexual annoyance මට අකමැති දෙයක් ඉංගියකින් හරි කරත්, words, actions ඉංගියකින් කරත්, that comes under 345. ඒතර හුඟක් වෙලාවට මේ harassment in the workplace 342, 344, 345 යටතේ අපිට legal support ගන්න පුළුවන්, නීතිමය ආරක්ෂාව ගන්න පුළුවන්, ඒ වගේම නඩු දාන්න පුළුවන්. 345 වල up to 5 years imprisonment, 344 වල up to 2 years. OPD එකේ ලෙඩු බලද්දී ඇවිල්ලා කරදර කරන කෙනෙක්ට එවල නීතිය උගන්වන්න බෑ. But we need to make sure that the public is aware of this. So we could be putting posters, setting them up so that අර waiting queue එකේ ඉන්නකොට අර අපිට පරක්කුයි දැන් ලෙඩු බලන්න මේ දොස්තර මහත්තයා ආවේ නැද්ද? රණ්ඩු කරන වෙලාවදී කියන්න ගහලා තියන්න section 344 පරක්කු කරත් මේක සිංහල දෙමළ forms වලින් ගෙවුවනම් මිනිසුන්ට ඉන්න ගමන් කියවන්න පුළුවන්. මොකද usually it's like our medical books written when we ask the public to read a medical book. තේරෙන්නේ නැහැ නේ භාගයට භාගය. දැන් මේක මෙහෙමම section එක ගැහුවට තේරෙන්නේ නැහැ. You have to clarify this, make it easily readable, easily understood way and publish it. Why? මේක කියවලා තේරුම් අරගෙනත් රණ්ඩු කරනවා. Definitely they need to be sued. What can we do? For anything, the rule number 1 is being aware. ඒ කියන්නේ දැන් දන්නවද harassment? harassment දන්නවනම් මම harass වෙලා තියෙනවද? මම කාව හරි harass කරලා තියෙනවද? either way, you have to be aware. Okay, මම කිව්වේ whether I am a victim or perpetrator. Be empowered to what? If I am a victim, I need to open up. For what? prevent me being re-victimized. Me හැමදාම පරිප්පුව කන්න බෑනේ. So I shouldn't be the victim again. The second part is maybe not me today. I was victim yesterday, but today another person. But මේක cycle එකක් අපි කඩන්න ඕන. Usually take my word. With experience, the perpetrator so-called don't go in isolation incidents. මේ ජීවිත කාලෙම මම එකවයි හරස් කරේ කියලා කරන්නේ නැහැ. So it's kind of repetitive behavior. අද එක්කෙනෙක් හෙට තව එක්කෙනෙක් maybe තව මාස 3කින් වෙන්න පුළුවන්. Usually the behaviors are repetitive. මට කරලා විතරයිනේ වෙන කාටවත් කරේ නෑනේ නෑ. There could be the next victim on the line. So be empowered enough to make sure another person does not be the victim. එහෙනම් empower වෙන එකේ තියෙනවා. දැන් මේක අහන් ඉන්න අයටක් තියෙන එක tactic එකක් තමයි maybe unknowingly I was the perpetrator in the past. But now you are aware. Now you went through my slides and you listened to this. Being empowered not to be a perpetrator again, definitely not to be, never to be a silent perpetrator. Be together. We all feel re-victimized again when you have felt nobody is there for me. මට කවුරුත් නැහැ. මේක කතා කරලා ඉවරලා මට තනියෙන් the fight එක දෙන්න වෙන්නේ නැහැ. Be together. Be together means be connected. As a team, as a group. අපි අලුතෙන් team එකකට ගියාම කරන දේ තමයි මිනිස්සුන් අඳුර ගන්න. So get yourself adapted and know the people around you. Everybody is not the same. There'll be මෙහෙමයි දැන් saints නේ උදේ saints ලා හැදෙන්නේ මලාම. හරිද? The saints are named after dying. So there'll be goodness as well as badness among us. අපේ ඉන්නේ percentages වල මූ 60ක් හොඳයි. So this one is 60% good, 40% bad. So focus on the goodness. There'll be more good people than you even imagine. So be connected with people whom you can trust. Being together, connectedness. Mangor is factor isolation kira. So more you isolated, you are at risk, you are vulnerable. So more you connected and be together, you are left alone. And arapikian mo allan the very it's untouchable. Right? So the perpetrator will think twice before approaching or hurting you. Then we be together kiyana ke tiyana. So always I tell my junior colleagues, never, I mean like working in isolation is very isolated in our then profession. Sometimes you are posted far away place. You are the only MO working there. So you will be only person on call at night. Okay, so what risk types? You know, be together. So there will be, you will not run the unit in isolation. That is where the interprofessional connectedness. Api team ekak idiyata there will be nursing officer, there will be supportive staff, there will be bystanders even whom you can rely on. So being together, having connections with everybody is important. Why? Connections make you safer. Stop denying. දැන් මේක මම දැම්මේ මෙතන මොකවත් නෑ. දැන් මේ ඔක්කොමත් දැනගන්නවා. ඊට පස්සේ මොකක් හරි මගේ ටීම් එකේ ආවම කිය නෑ අපි කියන්නේ මේවා. ඒක කොහෙද වෙන්නේ? ඒ උදාහරණයකට මොකක් කරාද කියන්නේ අංගුඩ නම් කීටවත් වෙන්න බෑනේ. Stop denying. Anywhere, everywhere we have. I mean, I did a research in 2018. So harassment happens anywhere. So our data is really astonishing. Right? So anywhere, anybody is at risk. So we need to stop denying. So accept and find remedies. Right? Goal would be $0. Then make a kiyan lassana $0 kiyan. Mama poddakko tolerate karanne. Then man kiya. අපි වේදන් ඔහොම කරන්න ඕනේ. වැඩිපුර on call කරන්න ඕනේ. වැඩිපුර shift කරන්න ඕනේ. හරි. දැන් normality abnormality හරි අමාරුයි සමහර වෙලාවට වෙන් කරගන්න. So remember, it should be averagely accepted by everybody. ඒ කියන්නේ දැන් මේ unit එක run කරන්න ඉන්නේ 5 දෙනා නම් rosters ඔක්කොම හදද්දි 5 දෙනාම එක විදිහට roster එකේ යනවා නම් that is average tolerance. හැබැයි එක්කෙනෙක්ට වැඩිපුර දානවා නම් ඔයා කොල්ලා හින්දා වැඩිපුර කරන්න ඕන නැහැ. එහෙම නැත්නම් ඔයා තමයි ඉන්න ජූනියර් එකේ. ඔයා කරන්න ඕන වැඩිපුර කරන්න දෙයක් නැහැ. ඒක තමයි. ඒත් එයා PG trainee. ඔයා register. මෙන්න මේවා තමයි අපිට එන sensitive issues where we will have to be very delicately handling. So tolerance, yes, accepted by the people in the group. Tolerance, not beyond that. Make a කියන්න ලේසි කරන්න අමාරුයි කියන එක. Once you go back and start thinking among yourself, you will see zero tolerance as a community, as doctors, if we can protect each other, not let any of us being hurt by us even. I think that would be way forward, because as a community, if we can get together and fight for each other, then we ourselves show them that we are not tolerating any amount of harassment. So as I said previously, WHO, they have very nicely drafted things or leaflets or booklets to read on that. And let me reiterate few steps. Harassment is preventable. Can you? So people think harassment is inevitable. Not preventable. No, harassment is preventable. There are 8 steps the WHO has recognized. First thing is recognizing. That's where the awareness comes. That's why we are doing this lecture, to raise awareness among us. ඉදනන් ඉන්න ඕන harassment මොකක්ද කියලා ඕක නවත්තන්න කලින්. And as a community, being responsible for each other, social responsibility කියන්නේ සමාජයේ වගවීම කියන එක. ඒ කියන්නේ මට ගැහුවා සමානයි ඔයාට ගැහුවා. ඔයාට ගැහුවා සමානයි මට ගැහුවා. So we are sharing our responsibility, looking after each other and being connected. Make තමයි first step එක. What's the second step? Improve your work organization setting. ඒ කියන්නේ working conditions හොඳයිද? අපිට physical resources ඇතිද? staff level එක ඇතිද? අපි stress එක වැඩි වෙන ඒවා තියනවද? තනියෙන්ද වැඩ කරන්නේ? තනියෙන්ද ඔක්කොම අදින්නේ? help තියනවද? අපිට දැන් සමහර තැන්වල for some of the instances, why the staff is on undue stress is people or the families not giving information when needed, where needed. The සමහරවට bystanders ඇවිල්ලා අපිට රණ්ඩු කරන්නේ ගහන්නේ ලෙඩාට මොකද වෙන්නේ කියලා දන්නේ නැහැ. So we need a setting for timely information. Reception එකක් හදන එක and setting down leaflet for people to waiting area එකේ අර වගේ posters දාන්න. හරි staff එකට කරදර කරොත් නඩු දාන්න පුළුවන් කියලා නඩුවට එනවා අවුරුදු 2ක imprisonment. නොවත් කියවන්න තියන්න. Timely information so that people even informed. ගහන්න කලින් මු දැනගෙනයි ගහන්නේ. Restrict movement in public in health facilities. This is very important. Sometimes public directly interfere with your duty of care. So restrict movement. When there is emergency going on, you should be able to send all the bystanders, all the family members, all the visitors out of that setting. So limited, restricted movement of public. And you definitely need security person. Providing security, as I told you before, it's the administrator's job, part of government's job. But remember, we need to get together and convince them so that our safety is ensured. The physical things like good lighting corridors, security cameras. Would you have an emergency signaling setting? You are assessing a patient becomes distressed. Who's going to help you? Where is your way of rescue? We need to look into these things. Whether you have security escorts from your quarters to ward or the between wards, very important. Do you have enough locks? Your rooms, drugs, valuables? I'm pretty sure even I lost my valuables during my internship. Some of us, we have very limited safety or security measures. Chaperones. Sometimes, because there is not available of enough staff personnel, we attend to emergencies or we see patients alone. So, you are totally putting your safety in jeopardy. So, Remember about chaperones getting another set of eyes to witness what is happening, and this is almost like you are protecting yourself from next lawsuit. So take a chaperone. Prepare and support each other. Are we trained enough to resolve conflicts? Or can we handle a disturbed person or disturbed bystander? If somebody comes and threats you or try to assault you, are you confident enough that you can look after yourself? Some of us may not be. So we need to train our people on conflict resolution, handling difficult patients, and communication. මේක කියන එක නෙමෙයි කියවෙන්නේ. ඔළුවේ තියෙන එක නෙවෙයි කියන්නේ කියන එක නෙවෙයි ලඩා තේරුම් ගන්න. So with communication gaps you are in problem. So develop your skills. And if you really need support, do we have enough counseling care or counseling support? We have to go and to whom to ask help. I have put physical and psychological stability. The last. As I said, if you are weak physically, if you are weak psychologically, definitely you are vulnerable. You need to look after yourself before everything. I always tell, healer has to be healed before healing. Mama hondata inna ona psychologically man tawa kenekata counseling එක. Personally, I never do. If I'm really feeling upset, I don't do counseling or any therapy. So remember, look after yourself first before divulging or helping another person. මොකක් හරි වුණාම තමයි ඔන්න ලොකුම ප්‍රශ්නේ. So do we respond quickly? If something happens, attend then and there. Vigilance. මේක හෙට උදේ කතා කරමු නැත්නම් අපි ලබන මාසෙ meeting. No, you have to respond quickly and appropriately as soon as something happens. And reporting is very important. Unless you report, there won't be any change of the incident or repetition is definite to happen. And the reporting very important. ඒකෙන් මම empower කරන්න වෙච්ච දේ කියන්න හරි වුණ දේ කියන්න හරි prevent future risk. Reporting is very important. Do we have complaint procedure, grievance procedure? වෙච්ච කෙනාට මේක තනියමද grieve කරන්න වෙන්නේ? තනියමද මේක දුක් විඳගෙන අදගන්න තියෙන්නේ? Complaint කරන්න තැනක් තියෙනවා. So these are the necessities of today. එන්න අපිට කල් දාන්න බෑ. Confidentially complain කරන්න තැනක් තියෙනවා. එහෙම නැත්නම් මං ගිහිල්ලා මේක කියලා කාගෙන්ද psychological support ගන්න. අපිට ඕනේ somebody to be responsible and somebody to monitor the trends and find preventive measures. මේ monitoring part එක අපිට කරන්න වෙනවා. So let me briefly tell what we did at NIMH, National Institute of Mental Health, as GMO, turning 100 years next year. Right? So NIMH, we are the first government institution to set up Committee Against Prevention of Sexual Harassment in Workplace, which we established in 2018 by following the research I did with my GBV team. So at that, we found 41% harassment in the workplace. So I said 1 in 3, we took only females. We did isolated females only sample where we assess the harassment past 6 months. It was 41%. So it was well more than the global prevalence. So we thought the necessity at that time was we need somebody, the monitoring or the responsible body who will take complaints, inquire and find remedies. So since 2018, the committee is functioning. Last year we had 1 complaint and we did the inquiry process and our suggestions to the director. And from the director, it will be forwarded to the ministry. So liaising with the ministry, we will be taking the necessary actions. All these became through the Gender-Based Violence Prevention Unit. That is the counseling center where we listen to grievances. කියන්න තැනක් හැදුවා අපි 2008 ඉඳන්. Staff, patients, bystander, walk-in, anybody can walk in and open up. So in my research, what we gathered was there was a lack of availability. මිනිස්සුන්ට කියන්න තැනක් නැහැ. ඒ හින්දා තමයි අපේ helpline එක ආවේ in 2018 October. We set up our mental health helpline 1926. 1926 තීරුවේ අංගොඩ හැදුවේ 1926 හින්දා. So 1926, it's a 24/7 toll-free helpline where you can reach and you can ask for help. There were 3 main goals setting it up. Availability around the clock. කතා කරලා අහන්න කියන්නේ. මොනවද දෙන්නේ? We give information. Where to go, what to do. We give referrals. දැන් ඔයා කතා කරන අනුරාධපුරේ නම් ඔයාට කොළඹ එන්න කියන්නේ. අපි කියනවා එයාගේ place එකට ළඟම station එක. එහෙම නැත්නම් ඔයා මෙතනට ගිහිල්ලා කතා කරලා උදව් ගන්න කියන එක. අපි mental health helpline එක ගන්න. So it's run by nurses who have worked in psychiatric facility more than 6 months. So they have a basic understanding into telephone counseling, which we train and put them in. So they offer counseling, which is very brief. So what do we get? We usually get, how many calls do you think?
Same.
About 150 calls a day, right? So that is, actually we are answering only 1 out of 5. Yes. So we have five telephone lines, WhatsApp line and a text line. WhatsApp line is 075471926. And මේවෙන් පහෙන් එකටයි answer කරන්න එන calls වලින් අපි agents ලා පහක් ඉඳලා. Why? We are getting loads and loads of contacts. At least 2 per day related to suicidal behavior. And still we are getting ambulance එකක් එවන්න බැරිද? Calls at least 2 per day. Right? So people are in need of help. So they reach us. Usually we refer, we hand over the information, where to go, to whom to meet. Because mental health is kind of a network. National Institute is a tertiary care center. So we are connected with all the peripheral teams. There's a connection of mental health units as well as community nurses. So refer කරද්දී සමහරලාට අපි කියන මෙන්න මේ station එකේ ඉන්න community nurse කෙනෙක්, go and speak to them. They will help you what to do. Right? So information center, sometimes you will get a quick psychological first aid. දැන් මෙහෙම එකක් වුණාම කාටද කියන්නේ කියලා හිතා ගන්න බැරුව ඉන්න victims, please contact 1926. You will be directly given the first aid, psychological first aid. Then what to do part. Sometimes you will be asked, come next day as soon as possible for a physical encounter where my team will go through your details and help you with necessary. So yes, please, we always encourage people to open up. When you are ready, we are there. Right? So let me finish again with this slide. The way forward would be being aware. Yes, now we are partially aware. Then be empowered. I can break the chain. I can make a difference. Then spread the message. So there will be people who wanted to join the session but did not. But tell them the harassment, it has to be stopped by us being connected. Stand up. You're never alone. We need to be together. And let us put a stop and say, we will not tolerate any amount of harassment at the workplace. Okay. So with that, I wind up. Hope to see you all again. So
Yeah, madam. Thank you very much, madam, for that. I mean, it's very illuminating. So many facts that we were unaware, and sometimes, I mean, we might have been, as you said, silent perpetrators at times. I feel like that. And in our question section, rather than questions, everyone is, giving out their grievances, and most of our MOs must have felt harassed at one point of their lives. That's what we see in the comment section. And madam, I have some questions regarding this. Sometimes, like during, especially in the internship. So during the training sessions, we feel like that the perpetrator, I don't know whether it's correct to use that word, they think what they're doing is character building. You do this, you undergo this training and you get a tough skin, you can face any problems. And at the end of the day, after a few years, even myself, I felt like, yeah, it was true. Like after undergoing that harsh training, I've developed a tough skin. So, is it okay to have such, mixed feelings? Is it harassment? And in that instance,
it is harassment, unfortunately. That's where we assume we are better with that. So it's a myth.
Mm-hmm.
So let's take it. So is working harassment?
No.
Working within the framework of developing skills is not harassment.
Yes.
But if you are given extra work with intention of so-called training hidden with bullying, that is harassment. For example, that's where extra shifts,
Yes.
extra work,
Yes.
or sometimes the sexual harassment with public demeaning, public punishing. Sometimes we are compelled to work harder. Then benung ahanna වෙයි මේක නොකරොත් SHO බණී කියලා ලැබ් එකට දුවන ඉන්ටර්න්ස්ලා කොච්චර ඉන්නවද? බොස් බණී, කන්සල්ටන්ට් බණී, ඉන්වෙස්ටිගේෂන් රිපෝට් එක නැතුව කියලා බණින.
No, we did that.
එතකොට did we develop any skills? Yes. Communication skills, මිනිස්සුන්ට නැමෙන්න, අනේ අර ලැබ් එකේ assistant අයියා කියලා මේක කරගන්න. That is not character developing. හරිද? අපිට කරන්න තියෙන එක තමයි senior colleagues as bosses. කලින් දවසේ investigations ටික ගෙන්නන්න ඕනේ කවුද කියලා බලන එක. So is it intern's duty? Of course not. So that is pure and plain harassment. එකට අපි කරන්න ඕනේ එකක්, name somebody responsible for investigation getting down, definitely not the medical officers.
Yes.
හරිද? ඒක nurses sister කෙනෙක් දාන්න කියන්නේ, දැන් supportive staff නැහැ කියන එක නේ කියන්නේ, sister කියන්නේ මොකක් හරි කරලා ඉවරලා පස්සෙන්ද උදේ 8 වෙද්දී ward round යනකොට investigations ටික කරලා තියන්න. So you divulge that responsibility. සමහර වෙලාවට public naming විශ්ව even I have been a victim. හරිද? කෙනෙක්ගේ ස්ලෝනස් එක වෙන්න පුළුවන්, කෙනෙක්ගේ ගෑනුකම ගෑනු වෙනවා වෙන්න පුළුවන්, එහෙම නැත්නම් ඩිස්ෆිගර් එකක් වෙන්න පුළුවන්. Everybody is not the plain and simple pure නේ. අපේ තියෙන imperfect, එහෙම නැත්නම් අපේ තියෙන වෙනස highlight වෙනවා නම් in public.
That's harassment.
දැන් ඔතන තියෙන්නේ how much we can absorb in.
Yes.
You are right now, you had a good adaptive and resilience capacity. We are not the same. සමහර විට ඒ ගානම ගිහිල්ලා internship එකෙන් ගෙදර ගිය interns ඇති. So every year when I'm working in peripheral stations, I will definitely get 1 or 2 interns who want to change the appointment to who says, this is enough, I'm leaving the job. So we need to think about those vigorous මේක අර physically punish කරලා එහෙම නැත්නම් ගොඩාක් tense කරලා කරන්න ඕනේ. For example, myself, I started internship becoming a pediatric house officer. හරි එතකොට මම PHO තමයි. ගිය ගමන්ම ළමයෙක් දැකලත් නෑ මගේ නංගිවවත් අල්ලන්න තරම් අපේ ළඟ ගැප් එකක්. ඒතර පොඩි ළමයෙක් අල්ලලම නැති මාව ඒ යුනිට් එකට දැම්මම myself and my SHO. So SHO අය තාම මම මතක් කරනවා මොකද he did not punish me. He knew the fact I am a novel. I have no skills at all. ළමයෙක් handle කරන්න දන්නේ නැහැ කියන. So he told me A to Z in handling children. හරි ඒතර මෙන්න මේව තමයි එන්න ඕනේ. Guiding does never includes ඕනේ harassment. Sure. You can guide them. හරිද? ඔය පනිෂ් කරන්න හරි ප්‍රසිද්ධිය කෑ ගන්න හරි ඒව ඕනේ. That is very unpleasant. Plus ඔතන එනවා ඊට පස්සේ you get mixed, as you said, mixed. මේක හොඳද නරකද? Then you feel like doing it to another junior person when you become senior. The mix idea එකෙන් එක තමයි නරකද? If you feel offended, you will never do it.
Yes, yes.
Mixed ආවම හිතනවා අඩේ මම මේක කළා බලන්න තව කෙනෙක්ට හරියයිද ඒක. So never get mixed ideas. You don't need to harass your juniors, right? සමහර වෙලාවට අර මම කියපු SHO he used to sit down with me and write cards. So the seniors සමහර අය කියනවා අපේ job එක නෙවෙයි card ලියන එක. No, he was a very humble person. I highly respect him still, right? So we juniors feel that respect.
That's true.
So seniors as you are listening, you don't have to harass the juniors. guide them, support them. They will respect you till the end of their career. මේකයි ඕනේ. දැන් ඔය අපි කර යුතු ඒවා තියෙනවා. දැන් අපි ABC monitoring කරන්නේ නැහැ. ABC of a job role තියෙනවානේ. දැන් as a intern මම මේ newborn ගේ physical examination එකක් කළා නැත්නම් එයා මට දෙනවා එක. අද නංගි නිදාගත්ත දෙන්න ඔක් කරන්න කියලා ඉවර වෙලා. But not never in public. මරක් වෙලා එළි වෙනකන් ඇහැරලා ඉඳලා උදේ ඕඩ් රවුන්ඩ් එක පරක් වුණා කියලා කෑ ගහලා එනවා නම් කියන්න කියලා කතා කරා අදසක. He never publicly shame me ever. ඒවා we need to get into our setting. මොකද and even at NIMH we have a beautiful setting where MOs and registrars, trainees share the roster. And NIMH is a very good example where the trainees are well respected. And so the MOs very nicely, they take the leadership, they respect the trainees, and they are like a family. Within unit family, they share the responsibility. We have family visits. අපි ඩිපෝ program එකේ family visits ගෙදරට ගිහිල්ලා injection එක දීලා එනවා. And so in my team personally we have 2 rounds for each month. So if registrar can't come, my medical officer will step in. That's where the connectedness, belongingness comes, so that we feel belong together.
That's the true professionalism.
Exactly.
Ma'am, you said that there is a hotline for such, gender-based violence incidences also for the public. But I don't know whether this is the correct forum to ask this. What about doctors? What about, is there any place that we can bring our grievances? Because we need professionals,
Correct.
Not a nursing officer, because we expect something beyond that.
Yes.
Is there a place?
1926 is basically for the initial psychological aid. So if you really feel upset, you don't have anybody to speak to, just dial 1926 and open up. Then ask for appointment at the gender-based violence unit, where you will be given a date and a time, so that you can meet myself and my team.
Ma'am, is there any program that we can have such units or a place for professionals to come and talk in each and at least in district wise?
Well, to be frank with, when we were setting up GBV unit under the Ministry of Health, Mithru PSA was opened up.
Yes.
So Mithru PSA basically targeting counseling, where they offer relationship issues, education issues, so conflicts. For conflicts, we offer counseling through Mithru PSA.
Right.
Usually, Mithru PSA liaises with the mental health team in the locality, led by the consultant psychiatrist. So, whenever they feel like they need added professional support, they reach, Mithru PSA reaches the psychiatrist and the mental health team. So, the teams who are, all the peripheral teams, now what somewhat stabilized, we have at least 1 consultant for the district. So, the best place to reach in your locality would be your mental health team, led by the consultant psychiatrist. Now, again, the stigma and the barrier. Then, pisunang vitarai psychiatrist hambenna kiyana එක you have to give away now. It's high time. We always talk about well-being, mental well-being. So, even at the private sector, now we see more and more people coming for help. Ma behed ganda නෙමෙයි ඉන්නේ කතා කරලා යන. So go and meet your mental health team professionals. So ඒ team එකෙත් ඉන්නවා දැන් මම කියවනේ diverse. සමහර විට psychiatrist වඩා reach කරන්න පුළුවන් එම්මෝ කෙනෙක් ඇති. So reach that person, ask for help, be open up, right? So you can always reach us at 1926 at GBV unit, right?
Yes.
You can walk in, ask for an appointment, right? We will warmly welcome you and do the needful, right? But trying to reach and trying to open up is the initiative.
Thank you very much, ma'am, for that extended explanation. And I can read the comment section. Everyone is very excited and grateful for this lecture session. And please let me invite you to, madam, if it is possible, shall we have another session?
Definitely.
In the near future,
definitely.
because it will aid us.
Correct.
Mostly because I can say like many MOs are with issues, but if they are opening up in this forum, in our chat section, so you can see how much stress that we are in.
Yeah.
And
another little thing, the GMO set up a separate committee.
Yes, ma'am.
And y'all are the separate, the main body will be liaising with the branch unions.
Yes, yes.
So way forward would be, we are taking this message nationally.
Of course.
So people will be more aware, so that yes, there'll be place and people to open up.
Thank you so much, ma'am, because I think we are having a subcommittee also to address these issues.
Yeah.
So we'll be liaising with you too, madam. Please help with us.
Yeah.
I mean, try your hands with us and guide us. So we'll meet again with another such interesting lectures. And until such time, thank you very much. Have a good day. Thank you so much, ma'am.
No problem.